This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello, everyone. This is Andy Southerland from the University of Virginia. And for this week's Neurology podcast, I am thrilled to be speaking with my friend and colleague, Joseph Sirven, for the latest installment in our Physician as Patient series. This series carries over from our prior April of 2022 Neuro Recall on the Physician as Patient series, and a recent interview I did as well in December with Bronzy Herpich regarding her prior history and experience of having suffered a stroke. A little background on Dr. Sirven. He is a professor of neurology, chair emeritus of the Department of Neurology at Mayo Clinic in Arizona and currently practices at the Mayo Clinic in Florida. He also has a number of leadership roles within our national organization as the chair of the AAN's Education Committee, editor-in-chief of Brain and Life on Espanol, and on the board of directors for the AAN. So the other thing is worth mentioning is Dr. Sirven is not new to podcast and radio media. He's a media personality himself, hosting a local show in North Florida, What's Health Got to Do with It? So folks can check that out online as well. With that introduction, I'll say, Joe, thanks for joining me for today's podcast.
Andy, what a pleasure it is to be talking to you today.
Well, Joe, the goal of today is not necessarily for us to talk about neurology and education and other things related to the field that we normally talk about, but really to focus on your experience as a patient having suffered a neurologic injury in the past, and to highlight that as a way to both share your story and also to hopefully provide some pearls of wisdom. So just as sort of an intro, would you mind, Joe, just relating your prior experience having been a patient, sort of where this was in your trajectory in your career and what it was like to be on the other side of that doctor-patient relationship?
The easiest way to frame this up front, because most people just find it so unusual. My background also, I'm a first-generation Cuban born in the U.S., but whole family. The reason I bring that up is because my family and I would always say that the story is a version of a telenovela. So it's that type of issue. This actually was back in when I was a sophomore medical student. And basically what happened was that and I'm not kidding you here, I was literally taking my neuropathology Christmas final. And I had one of the worst headaches that I could ever recall in my life. And it just kept getting worse. I assumed it was stress. I thought that, boy, I need to really not study as hard or take better care of myself. But it just kept getting worse. And the problem was, as I was taking this test, I remember that it got to a point that I'm like, I think I'm going to pass out. But I kept telling myself, don't do it, don't do it, don't do it, don't do it, don't make a scene and all of this stuff. I held out. I got into my car, got to the apartment, got into bed, and literally the next memory is awakening some days later with a nurse in a recovery room saying, Mr. Sirven, good morning. You had an emergency craniotomy. I'm so sorry. And I thought it was like, what? I mean, this is surreal. So what ended up happening was that I had an AVM in my right parietal lobe that bled to the point that it was near herniation. Now, that's my portion of the memory of the story. Then it becomes easy. Now, my wife is a nurse. She has a very different story to tell than mine. She tells a story of basically finding a lethargic med student in bed and getting someone from the apartment we lived in to get into a car, going to this emergency room in New Orleans, and basically the ER doctor telling her that this is obviously cocaine intoxication, that I had to settle the fact that as a med student, that's what stress does to you. I'm like, well, a neuro exam would have probably helped to kind of delineate that in mind, and a drug tox screen. But nonetheless, she was given a long lecture about the fact that I am an addict and all, and this is how it goes. And fortunately, she ended up being an advocate and called a family member who's a physician of my brother, and they got a neurosurgeon to literally jump in and do emergency surgery and fundamentally saving my life. It was a mess. It was one of those situations that it was done so quickly because of the fact that I was already in a herniation stage that, let's just say, I ended up with a cerebral abscess 3 weeks later from the skin not being scrubbed as well, because of how fast or quickly they were going in to do this. So I ended up with a second craniotomy to take care of that infection. But this is so long ago, and here I am so many years later. It tells you that you know the outcome, no deficits, survived okay, but it forever altered the trajectory of everything, pretty much, when I think of that story. And this was a while back. It was just a very crazy time. And I was out not as long as you may think, but about a month. And then I caught up, which was one of those other stories in terms of just trying to get back into it. But that's the long and short of this very, to me, is like kind of a very melodramatic story. I can tell it because, as you can tell, I have very little memory other than the parts before and after. My family tells a very different story. And there were a lot of ups and downs, including the moment, because this happened close to a weekend, the pathology had not come back. So one of the physicians told my family that they were positive this was going to be a stage 4 glioma and that they had to be prepped. So I wasn't aware of that. They were, basically citing me off, and like a roach in New Orleans, I guess I'm still here. So, I mean, that's the bottom line.
That is a harrowing story, a telenovela. We should invite some family members to give their perspective, perhaps, in this sequel to this. And as you point out, the vignette for the stressed, sleep-deprived medical student showing up lethargic in the ED includes a differential with a number of things well ahead of a ruptured AVM in that moment in time. But thankfully, it was recognized, treated. I can say, today, I wonder if you could have just been more accomplished if you'd had a better treatment and outcome at this point based on your introduction there. But no, in all seriousness, Joe, that leads into the sort of the second question, again, where your memory does come back. And you mentioned the fact, thankfully, the recovery was relatively short given the extent of the initial injury. Are there any lessons that you recall from that time? Again, I know that this is before you had become fully vested in neurology, but about just that recovery period itself, how you interacted with the healthcare system. Are there any lessons you feel like that are worth sharing, particularly for our students and our trainees who are dealing with patients who have suffered neurological events like this?
My story was always more about listen to what is happening to the person in front of you. Take to see what are the situations that are occurring. I remember in so many instances where just the miserable pain after this and just asking for relief. Also, kind of like, from a cultural standpoint, I remember being awoken in the middle of the night in the ICU. And I was very frightened of this, but this is kind of touches about the healthcare system there, surrounded by a team of people in a prayer circle. I don't mind prayer, but I like to know that I'm in it, like at the time. So that was like one of those other things. So know what makes people feel comfortable or not. Otherwise, it gets misconstrued. The communication, if you can't do something right, then stop. So many people try to force IVs for antibiotics, do things like that. And luckily, by that point, I had an army of people questioning anyone touching me, what's going on. The lessons are really just, it's a simple one. Just see the person in front of you and do unto them as you want done to you. And that's from respect to what's going on with pain and comfort. Again, I was blessed because I had a very loving, wonderful family around me who then did not let go of anything at that point onward. But what if you are alone? Advocating for yourself and for others, those were the biggest lessons of all. Because even so many years later, that's what I recall was just people insisting they have to do this by the book, when at the end, it's listen to what's in front of you, what makes sense, what's human is what really matters. And it's what you remember. And that is one of the things I remember. I remember people who visited and were kind, and the voice or even a touch, those things mattered. And sometimes I don't think that gets enough discussion in the medical field.
Yeah, these are tenets that seem self-evident, certainly as we're entering into the medical field and we're at our most ideal state, but they're easily lost or at least hidden behind a number of other stress priorities when you go through training and residency and so forth. So it's until you've been a patient and in your position or a family member, it's hard to realize how important those soft skills are and that recognition, but a lesson learned well. And then, of course, going on to neurology, which one would assume that this had some impact on. Now that you're a seasoned neurologist and have been so accomplished in this field, in many roles, both as a clinician and as an educator, looking back on it now, just with the lens of a neurologist, are there lessons that shape your perspective or that you use to help educate your residents and fellows and trainees?
First of all, I took this all as a sign that if I wasn't going to become a neurologist, then I was fighting the universe or karma. So that's like, listen to what the universe tells you. Outside of that, if I had to be kind of from a lens of neurologist, a few things. Number one, even if a CT isn't available, I don't want to date myself, but this was in that zone between CT to MR, a good fundoscopic examination could have probably less than 30 seconds by someone who knows what they're looking for, could have probably sealed the deal that of where and what to do in the next moments, as opposed to making an assumption about a demographic or a situation. So number one, things like fundus exams that we don't often teach as much or discuss, those things do make a difference and could have made a huge difference in a situation like that. The second thing is, I laugh in this day and age of ChatGPT hallucinating based on what it thinks is the correct answer based on just statistics. This to me strikes me as that same type of deal. A young medical student, headache, must be X. My sense is don't do that. The history still matters. Look at what are the other possibilities and don't get locked into one diagnosis. Otherwise you get someone into trouble, which could get them into a serious situation. It turned out okay for me by luck and by a lot of people around me. Had I not had that around me, I don't know if we'd be having this discussion, to be honest with you, Andy. So the biggest lenses that I have is just consider all the facts and all the possibilities and believe the patient. Certainly some people lie, but a lot of people don't. And so if they show up and they're like, this is new, it's new. You can check other studies. Just kind of listening to the patient is what it gets back to.
Yeah, it's amazing how often we do this in this series, and it really does come back to a lot of those core fundamentals and the experience, again, of being a patient and the human skills that I think are innately important to being a neurologist. And then, as one of my mentors once said, neurology is one of the few fields you can practice without electricity, and that gets back to that history and basic exam and so forth. Although I guess you would need a battery for your fundoscope. But those are just great lessons. And again, lessons learned from the wisdom of your experience. Joe, I appreciate it. You sharing it with me. Just when I think I know you, I learned something new and complex and interesting, and can say that for me, and I guess the rest of our field, it's not an understatement to say that we're glad that all those things did fall into place when you were a medical student, and for you to have a quick recovery and to be the person you are today. So I think, the good news about this is even though we have to wrap up our podcast, for our audience, we're actually going to be interviewing Dr. Sirven live on stage at the upcoming annual meeting of the Academy in Denver. We're going to have several of our physicians as patients on stage with us, again, to share their perspective live and then as a prelude to this podcast. And so we're excited about that. So multiple venues to be able to have this conversation, perhaps learn more, ask additional questions. But for now, Joe, thank you for sharing this perspective. Thank you for all that you do for the Academy, for the field of us as neurologists. Any last minute things you'd like to say before we wrap it up here?
I'm just always so thankful that, oddly enough, that it happened. In many ways, it set a course. It made everything very clear. And I guess I would consider myself blessed in that way, that I knew what I must do. And here we are talking about it, neurology or bust. And so happy that I can look in the rearview mirror and maybe we can help somebody else when they hear stories like that.
Indeed. I think that's a great note to end on. Again, this has been Andy Southerland speaking with my friend Joseph Sirven from the Mayo Clinic about his experience, patient, and we'll look forward to our additional conversation. Joe, thanks so much, and we'll see you down the road.
Absolutely. Such a pleasure.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please Take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.